So the first two steps are determine your rhythm and your rate, right?
Mm-hmm.
So remember what I said about the rhythm. So how do you determine the rhythm?
So for the rhythm, we would be looking at the from here to here, right?
Yeah.
And
so
seeing if it's consistent.
correct.
all
So
throughout.
I normally would get like a paper. Let me borrow a paper. I'm gonna march it out. Yeah. But just maybe please. I don't want to waste your big giant paper. So when I say march it out, so what I mean is I get the paper, right? And then let me just go back. So like if this is a printout, so I would look at where that R is right there, and this is a touch screen, so I'm gonna be careful not to touch. R to R, right? So this is the distance of my R to R. So what I'm gonna do to see if it's regular rhythm is I'm going to align them with all the other R to R's. So in an EKG class, we use a caliper, okay? Those little things inside of paper. But, you know, you don't need to be that fancy. You know, this serves the same purpose, right? So you march it out if you're visual. If you want to count, by all means, you can count, right? So you can count like how many either big squares or small squares are here, and then count the same, you know, for each one to see if they're regular, if they're all the same. Then if that's the case, then you know, okay, the rhythm is regular, right? Now you do the rate. So how do we measure the rate?
So for the rate, we would count the small squares. So it would be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 divided by 1500.
So 1500 divided by 16.
16.
And you know that one big square has how many small squares? 5. So you can, you know, so save yourself some time. You can just count by 5s the number of big squares that are there.
Oh,
right?
yeah.
and then whatever's extra, then you just add that, right?
Okay, yeah.
So 1500 divided by 16.
That was
93.75, 94, right? You can round it up to 94. If it was the big squares, so count the big squares again.
It was 1, 2, 3.
So 3 big squares, so 300, you use the constant 300 divided by 3.
So that would give us 100.
So the small squares is more accurate than counting the big squares only.
Because then we would have said the patient had a rate of 100 when really it's more 93-ish.
Right, exactly. Okay?
Okay.
So then from the rate, we determine, is this normal rate? Is it a tachy? Or is it a brady right away? Right? So I call that the last name of the rhythm.
Okay.
We're giving the rhythm the last name already.
Okay.
Right? Tachy or brady or normal. Right?
We would say it's normal, right? Because it's between 60 and 100.
That's right. So then what do we do next? What do we look at next?
We would look at the P wave if it's normal.
Okay. So a normal looking P wave would be smooth, right? And if you were to split that P wave in half, it should be pretty equal on both sides. And that tells you that there's no enlargement of either the right atrium or the left atrium if they're normal, right? And if it's smooth and normal looking, that also tells you that that P wave conduction came from the sinoatrial node, right? Okay.
Okay.
So normal P wave.
So it is normal, and then we're looking at if there's one P wave per QRS complex.
So one P wave for every QRS.
So P QRS, P QRS, and so on. So that's normal.
Good. And if you didn't have one P for every QRS, then you know your rhythm's irregular. Right? Okay.
Okay, and then we're looking at the PR interval, if it's normal or prolonged.
And what is normal PR interval?
We said it was 0.2
0.12
to 0.2.
to 0.2. The way that I look at that is I just find a P that begins at the beginning of the square.
Okay.
You know, like on the line of the square. So you find one, and then I look and see where is the QRS. Does the QRS begin after that big square, or is it within that big square? Right? And if that's the case, if it's within that big square, then I know that my PR interval is not prolonged.
Right. Because a big square is 0.2 seconds.
Correct. Yeah. So
like this one is a good example.
yes, exactly. So you know, you can just eyeball it. Now you can't tell if they're all the same. Right? So now you can march it out again. And now what we're looking at is we want to see, are the PR intervals consistent? Okay? Are they consistent? Are they all the same all throughout the EKG? Okay, so now, yeah, align them. They're all the same.
Yeah.
Okay. So then there's no, what problem is it if they are too long or inconsistent? There's no, you guys know?
Atrial dysrhythmia?
AV block.
Okay,
Right?
AV
There's
block.
no AV block. You're not worried about an AV block if the PR interval is normal,
Okay.
right? If it's not
Oh, right.
prolonged.
Okay.
All right, and then what do we look at next?
And then we're gonna look at the QRS if it's narrow.
Right. And and what is considered narrow?
Less than 0.12 seconds.
Correct. Less than 0.12, right? Some textbooks or some hospitals will give you maybe 0.6 to 0.1 or 0.08 to 0.12. Okay. So as long as it's not wider than 0.12, I'm good with it.
Okay.
And how many small squares is that?
3.
So let's count. How many small squares from the beginning of the Q to the ending of the QRS complex? So in that case, that's the S,
1.
right?
Oh. This one, right?
Yep.
So that's 1.
Okay, 1 for all of them?
1.
It's pretty narrow.
Yeah.
Okay.
So
Okay.
it's only 0.04
0.04. They normally would be a little bit wider than that, but that's fine. At least it's not wide, right? So because it's not wide, what can we not call this rhythm?
Ventricular.
Right.
Irregular.
So then we forget the word ventricular because there's no ventricular problem. The QRS is narrow.
Right.
Okay, and then
we look at the ST segment at the baseline, if it's elevated or inverted.
right.
So
the ST segment we don't measure in time, right? We see if it's above or below or at baseline. Okay.
Which it's right
It's
at
right
the
at baseline. So what are we not concerned about? If it was elevated, we're concerned about
STEMI. STEMI.
So an MI, an infarction. If it was depressed, we might be concerned about ischemia. Okay, so in coronary artery disease. Okay. Okay, next.
And then the last one is the T wave. If it's tall, normal, or inverted. So we could see that it's definitely not inverted.
And what's the normal height of the T wave in correlation with the R wave?
It should be 1/4 to 1/3 of the R wave.
So the R wave and then the T wave. Okay, so it should not be greater than 1/3 of the size of the R wave or less than 1/4 of the size of the R wave. Okay, so that's pretty normal looking. And then, was that the end of your list?
Yeah, that's it.
Okay. So then it meets all your criteria. So then what is this?
Normal sinus rhythm.
Very good. NSR, normal sinus rhythm. Go ahead and X that for me on the very corner there. Okay, perfect. So now, so tell me what's going on here. So what's the first two things that we do?
Rate and rhythm.
Okay.
Or rhythm and then rate.
Right.
So the rhythm,
and you can go back to the EKG 12 lead if you'd like, and then maximize it.
okay. So already we could see that the rate is tachy.
Well, let's measure it.
R to R.
Yeah. Well, just count how many. Well, that's, you're marching out for the rhythm, right?
Okay.
To see if it's regular.
Should I do the rhythm first?
Yes. So you do the rhythm first. That way you know if it's regular or irregular.
Didn't even mark it. Okay.
So you go to the tip. Go to the tip of the
Oh.
arm.
Sorry. Okay.
Okay. So all the same.
Regular rhythm.
Okay. Regular rhythm.
And
then the rate.
The rate we need to count. So, that's like 5, 6, 7, 8, 9. So we would do 1500 divided by 9. 166.
Okay.
Okay.
166. So we don't, you know, like how if you print a 6-second strip, you can count the R waves. I don't use that method.
Gonna use that method.
It's pretty inaccurate. If there were other things that were going on, especially if the heart rate is irregular, right? Because you're just taking a 6-second snapshot. But you know there may be other things going on. Okay, so because of the rates, we're calling it
Tachycardia.
a tachycardia. So we have a last name. It's a tachy. Now, what kind of tachy?
So now we need to look and see if the P wave is normal.
Okay.
So.
Or if there's a P wave.
Right, if there is a P wave.
Is there a P wave?
There.
Don't count that one.
I would say yes.
So what's the first one to disappear? I told you.
Oh, the P wave.
Why?
So actually, because they hide behind when the QRSs are more frequent.
Go back to the telly now, because I think you get a better view there. Yeah.
Okay.
Okay. So you're looking at this. So there should be the first positive wave is the P, and then you have the second is the R, and then the third is the Q, as the T. Sorry, right? So P, and then the R, and then the T. Those are the 3 positive waves, right?
Right.
How many positive waves do you see?
2.
2. So meaning 1 is missing. And again, the one that would be missing first is the smallest, which is the P.
So
there's no P wave.
seeing T waves right here.
Correct. So those are T waves,
Okay.
right? Because there's no P wave, what can we not call this rhythm?
Atrial.
We can't call it atrial. Can we call it sinus?
Do we have enough info yet?
Well, if it's sinus, what wave would you see? You would see a P wave, right?
Okay.
And we already said there's no P wave, so therefore it's not sinus, nor is it atrial,
Okay.
right? So, and then what's the next thing that you want to look at?
If there's, well.
So we can skip the one
One
P
P.
for QRS because there's no P's.
And then the PR interval, normal or prolonged.
Well, we can't
we don't
measure
know.
that because there's no P's.
So then we're gonna look at the QRS if it's narrow.
And they're narrow, so we can't call it
Ventricular.
right. So it's not a V-tach, right? Because the QRS is narrow. It's not wide. But there's no P,
Right.
and it's a tachy.
So we
kinda
might
tachy.
be looking at SVT.
Very good. So supraventricular tachycardia, meaning that the the impulse is coming from above the ventricle,
Mm-hmm.
maybe somewhere in the atrium, but we can't say that for sure because there's no P wave to prove that it's in the atrium,
Okay.
right? So
Mhm.
we're saying it's above the ventricle, supraventricular tachycardia, right?
Mm-hmm.
Also because of the rate, right? So usually a sinus rate is 120 or less, right? If it's tachy.
Mm-hmm.
Atrial maybe about 150. This is greater than that. That's why you're not seeing any more P waves.
Okay.
All right, let's switch seats. Let's try Ami.
Okay.
You can do it. You can do it. No, we'll walk you through it. Have a seat. We'll walk you through it. Jessica's gonna teach you. Okay, this will be easy. I promise. Okay, so let's go through the systemic approach again. Systemic. What am I trying to say? Did I say it right? Systematical approach. Thank you.
They both work. Oh.
So, this is a systematical. Okay, rhythm and rate. Those are your first two things, rhythm and rate. If you want to go to the EKG at 12 lead to look at the rhythm, you may. So click on that EKG icon there, magnify it. So look at the lead 2 at the bottom. So we're looking at the rhythm. Here's your paper. You can march it out. Use the correct time.
I know, I was like, is it 12? Let's see, 10 to 18. Yeah.
So the rhythm is regular.
The rhythm is regular. Good. Okay, rhythm is regular. What about the rate? So count the rate. So how do we count the rate, the ventricular rate?
Big boxes between
The,
R's.
very good. So let's count the R to R boxes.
Almost 7.
Okay, so we can't round up. So you either use the big boxes or you use the small boxes. Because if you round up, then it's not accurate, right?
Okay.
So how many big squares? And then count that by 5s.
1, 2, 3, 4, 5, 6.
Okay, so 6 times 5.
6.
Or you can just go 5, 10, 15, 20, 25, 30. Right?
So 33.
30 plus how many small squares?
1, 2, 3.
3. So 33. So what constant number do we use?
1500.
1500 divided by 33.
That's 45.
45. So and look at the top. 45.
Mm.
See heart rate? 45. Right there at the top. It says heart rate of the paper.
Right side.
Oh.
Yeah, heart rate 45. So you were accurate. So by definition, this is a,
Brady.
what's the last
Brady.
name? Brady.
Brady card.
So we have a Brady rhythm, right? So now we're gonna figure out what's the first name, right? What kind of Brady? So then we'll look at the other criteria. So what do we look at next, Jessica?
If the P wave
P
is
wave.
normal.
P wave is normal. Are the P waves normal? They're normal
looking.
looking. They're not upside down. They're not
No.
pointy. Okay, so they're pretty normal looking.
Mm-hmm.
Okay, so what's next?
Is there one P wave for every QRS?
Okay, so 1P for every QRS, which means it's
Yes.
regular. Yeah, okay, good.
And then we're looking at the PR interval if it's normal or prolonged.
Okay, so let's measure the PR interval, and what that would do is it's gonna rule out any AV blocks, right? If the PR interval is prolonged, then there's some kind of AV block going on.
It's pretty narrow. It's just one small box.
Okay, but then you gotta march them out. Because you're ruling out Winkelbach, right?
Yeah,
Mobitz type 1, because in type 1, they prolong. That's why you gotta look at all of them
It's the long,
to make sure they're
longer.
consistent. Long, longer, longest drop.
They're consistent.
They're consistent, good, and they're normal. So no AV block, right? Okay, next. And this is important in this case too, because this is Brady, right? Because AV blocks are Brady's.
So now you look at the QRS complex.
QRS complex, very good. Is it narrow or wide? And what's the measurement on our QRSs?
Oh, sorry, that's one small box.
Yeah, I don't know why this computer makes it so narrow, but at least it's not wide, right? So we can't call this ventricular, right? So then next.
Next, we're looking at the ST segment at the baseline.
So that's not really part of the analysis of the dysrhythmia, just so you know, right? We're looking to see if there's underlying ischemia or infarction. Okay, so because it's just part of the method of looking at a 12 lead. But you don't need to do that if you're just analyzing the rhythm, okay? But it's just a standard that we always look at that. So is the
And
ST,
ST will be from here
correct?
to here.
Yes. So that's the ST segment. And is it at baseline, or is it higher than baseline, or
It's
lower
our
than baseline?
baseline.
Baseline. So we're not concerned about any infarction or ischemia. Okay. Again, good to know because this is a Brady.
An inverted segment would mean
Ischemia.
and a elevated would be a MI.
Correct, an infarction. That's right. Okay, next.
Then we're gonna look at the T wave. If it's tall, normal, or inverted.
Okay.
It's normal.
So it's
Tall
normal,
and
right?
normal, yeah.
1/4 to 1/3 of the height of the R. Can you X that out for me, please? So we're not worried about any, what? If it's too tall, what are we worried about?
Hyperkalemia.
Or
MI.
or infarction. If it's flat or inverted, we're worried about
Hypokalemia.
or
ischemia.
ischemia. Okay, so sometimes the infarction or ischemia may not show in the ST segment, it may also show in the T wave. Okay, so we're not worried about that. So now what do we have? There's normal P's. It's a Brady.
Sinus Bradycardia.
Very good. Sinus Bradycardia. You know it came from the sinoatrial node. That's why you're calling it sinus, right? Because it meets all of the normal criteria.
Pacemaker problems.
Make sense?
Yes.
Okay. So this patient probably had what medication do you think lowered the heart rate?
What medication will lower the heart rate?
No, like maybe a typical medication that they were taking, digoxin, and what else could the patient have been taking that lowered the heart rate too much?
Can't they take a beta blocker?
Yeah, so it could be a beta blocker. Very good. Okay, X that out. We're gonna kick it up a notch here. Hold on. Let's see what we will get at.
Huh? No, there's no cheat notes here. Nothing that would be useful.
No, tell Jessie.
Here's your pen back.
Oh, thank you. Okay, so let's start with a telly. Because if the telly was normal, there's really no need to do a 12-lead EKG, right? So we can eyeball off of the telly.
Okay, we have a P wave, we have a tall now.
Wait.
Oh,
Back up.
back
What's
it
the
up.
first two things?
We're looking for rhythm.
Okay. Is the rhythm regular?
I could go back to my strip
Sure,
now?
yeah.
Okay.
If you want. Yeah.
I'm gonna eyeball this really quickly though.
Yeah. That's what I'm saying. Like, you know, if
Present
you have a
P.
patient on a telly, you could kind of see if it's regular or irregular, right?
This actually will be useful because we're going to be on a 4th med card.
Yes. And you'll be the consultant for the whole class.
I'm not going to say anything.
Okay, I see irregularity already.
No. Yeah, we're
Okay.
yeah.
All right, look at my second lead here.
Alrighty.
Okay, let's look at my look at my rhythm first.
Okay.
Okay. And to look at my rhythm, I need to measure the I'm looking at, rate is measured between the R's of the complex. So rhythm is looking at the P.
No, it's still the same.
It's still the
R to
same?
R.
Oh, okay, R to R then? Okay.
We can do P to P, but generally speaking, we'd
not
like to
ac-
see what the ventricles are doing
Okay.
instead of the atrium, right?
Yes.
So if there's one P for every QRS, then we know it's just the ventricular that we're going to look at.
Okay.
So you're just marching them out to make sure they occur at the same time.
And more so not to be selfish, but I don't want to be wrong and give people bad info because I need to practice.
You can tell them to reach out to me
Yeah.
or watch my videos.
Yeah.
Don't you all call me at the same time, just watch the videos.
Because I need to practice this.
It'll take time.
Mm-hmm.
But that's why I teach the method, because I don't want you guys to just memorize how it looks and then get it wrong because you didn't analyze it, right?
Okay.
So is it regular?
Regular rate.
Awesome.
Yes.
Okay, regular rate. So that regular rhythm.
Sorry,
so that
regular
means
rhythm.
that we can just measure one R to R distance, and then the rate will be true for all of them.
Right. Okay. So 1, 2, 3, 4. We don't round up, correct? So 1, 2, 3, 4. So I have four large boxes. So we multiply that.
So so if you're seeing that there's some extra small squares, that means that big squares is probably not the way to go, because it'll be too vague.
Too vague.
Right?
Okay.
It's not going to be as accurate.
Okay.
So you can use the small squares instead.
Okay.
So 5, 10.
Oh yes, right. 5, 10.
5 for each big square. So 5,
5,
10.
10, 15, 20.
There you go.
Add 2.
There you
22.
go. Exactly.
1500. 22 divided by 1500.
1500 divided by 22.
1500 divided by 22. That's going to give me 68.
Okay.
And okay, it's at 70.
Yeah,
Close. Okay. So we're going to get a last name now.
That's right.
So we are within range. So
Good.
we're at 68. 60 to 100 is our
So it's normal.
normal, yes.
Okay, so it's normal.
Okay.
We don't have a first name yet, so we can't call it sinus or anything, right?
Okay.
Okay.
Okay, so now we can start looking to see if there's a present P wave,
That's right.
and then its characteristic.
Mhm.
All right. So there.
So look at all the P's first, and you're looking at all of them to see if they're normal looking. Just the P's, normal looking. They're not pointy. They're not inverted. They're all the same shape. They're not different sizes and shape from each one. Do they meet that criteria? They all look the same?
Yes.
Okay. So far so good.
So far so good.
Mm-hmm.
Okay. Next.
So you're saying there's no atrial issues so far that you see?
No atrial issues.
Okay. Mm-hmm.
Okay. Next, we're going to look at our PR segment.
PR interval.
PR interval, excuse me.
Mhm.
PR
Okay.
interval. PR interval, okay?
Mhm.
So now I'll do the same measuring scale. And that's measured from the beginning of the
Beginning of
P
the
wave
P.
to the Q, correct?
Correct.
Okay. Oops, it's touch screen.
So first of all, which one are you doing? Are you measuring if it's prolonged or not, or are you
Yes.
marking out if they're consistent?
Okay, I'm gonna first look if they're consistent,
Okay, sure.
and then I'll see if it's prolonged.
Okay.
Is that a valid order to
That's
go
fine.
by?
Mhm. I probably would have looked to see if they're prolonged first. That way, if it's normal,
Mm-hmm.
then there's a lesser chance that I have an issue. But then you can, it's okay. It doesn't matter.
Okay. They're prolonged.
They're prolonged.
Very
now,
obvious.
Are they consistently prolonged? So let's back up. So they're prolonged. So therefore, we already know we have a category.
Yeah.
This is a what?
AV block.
This is an AV block, right? We have an AV block. Now we need to find out which kind of AV block, right?
Okay.
So which degree, right?
Right. Okay.
So now you look at your criteria. So now you march them out, and sorry, did you already march them out? You said they're consistent.
I was gonna do that right now.
Okay.
Because we know that they're prolonged because
Greater
it's
than
3 small boxes.
no, five small squares, which is one big box, right? PR interval is your PR, yeah. Which is 0.2 seconds.
0.12 to 0.2 is the standard, correct?
Yep. Good job on being thorough. So he's going through all of them, all the way to the end. So
Okay.
You'll never know. You may catch one that's not the same.
They are consistent. They
They're
are
consistent.
consistently prolonged.
They're consistently prolonged, and that's a criteria for which degree?
First degree.
First degree.
Mobitz.
No.
That's
Oh, sorry, that's second degree.
So
First degree. Okay.
So we got so what's our problem?
Okay, so
What is this rhythm?
Normal.
We can't call it
it's not normal. No.
So what is it? What do we call it?
First degree AV block.
That's right.
First
This is a first degree
First
AV
degree
block.
AV block.
That's it.
But the rationale wise, there's a disruption. There's some type of traffic, right?
Yep.
There's some type of electrical delay.
Yep. Where?
So this has to be in
In the AV node. That's why it's called an AV block.
right? Because the QRS is tall and narrow, so obviously I'm eliminating anything ventricular, correct?
Correct. Yeah.
And then I'm looking at I'm just going through the steps, and then I'm looking at my T waves. My T waves are not more grand than 1/3 of the QRS complex, and there's no inversion or a spike, so we can't say there's an electrolyte imbalance.
Right.
As an example, so first degree hard block, and our P wave is normal. Our PR interval is greater than 0.20. Our QRS is less than 0.12. Rate is 60 to 100, hence we had 68, 70, and there is regularity. Now, what can we say about underlying situations here?
That's a good question.
Based on what you said last week, for example, there could be some type of, for example, sepsis causing a valvular issue.
Not with first degree.
Not with first degree?
First degree is actually pretty benign.
So they're talking more of enlarged myocardium?
Nothing.
Nothing? No inflamed myocarditis? Nothing like that?
Nope, nothing.
Oh.
Because the problem is in the AV node, right? It's in the AV node. It's just a little sick.
Oh.
That's it.
Okay.
Pretty benign. You see it a lot in, you could call it kind of more wear and tear maybe. You see it a lot in the GERD
advanced
population.
age.
Yeah.
Okay.
You may see it in a younger population, but that's just a aberrancy in their conduction system.
Okay.
As long as they don't have any symptoms, there's nothing to worry about.
here for pediatrics, one of the reasons could be infection or myocarditis.
For first degree block, possibly.
Or congenital
Yeah, for
disease.
peds, yeah, if they maybe have a congenital issue, in that case, that's it's good to look at your entire EKG, the T wave, the SC segment, right? Like Alex did, to make sure that there's no other issues that could point back to the infection or whatever the condition is of the patient.
Could I bother you to put a third degree?
No, because I will tell you. You will tell me. What
And I'm telling you.
No, you will tell me what the rhythm is when it comes.
Nice try.
Sorry,
Go ahead and X that out.
I got nerdy right now. Okay.
All right, back to you, Jessica.
Okay. So we could already see that it's irregular. And
Is it?
Yeah.
What is irregular?
Um,
How do you measure regularity?
Oh, wait. Well, just based on looking at it.
You're saying there's something abnormal,
Yeah,
not
yeah.
irregular.
Yeah,
There's
yeah.
something abnormal that you're seeing.
Yeah.
Okay.
Okay, so then I want to go to my
Okay.
EKG. Okay.
That looks beautiful. That's the most perfect thing I've ever seen of this rhythm.
Okay, so we're gonna look at the rhythm first. So I'll need to map it out. Can I borrow your pen again?
Of course.
Thank you. Measuring from R to R. Okay. So the rhythm is, the rhythm is regular.
Okay, rhythm is regular. Very
Now
good.
for the rate, 5, 10, 15, 16, 17, 18, 19, 78.
Okay.
Okay, which is in the ballpark.
Okay.
So we could say that our rate is normal.
Uh-huh.
Now we're looking at our P waves, which are not there. Because we said the P waves are the first to disappear.
Well, true,
Uh-huh.
but could there be multiple T waves?
No, because actually then that means that the heart is like constantly resting for multiple.
Right. Doesn't make sense.
Okay.
Okay.
So then these are most likely multiple P waves.
Uh-huh.
So
So if you were to look at how they look
right.
and looking at the criteria, do they look like normal looking
No,
P waves?
because they're not smooth, and if I split
Uh-huh.
it in half, they're not
Uh-huh.
equal on both
Very
sides.
good. Very
So
good.
right now, it's kind of looking like a right-sided enlargement. But we don't want to say that yet.
Well, it could, but there's too many of them to tell you that that is the actual problem.
Okay,
Right?
so
But we know that there's an abnormality with a P.
right.
So then therefore,
We could say maybe it's a multifocal.
well, let's back up.
Okay.
So there's an abnormality with a P, so
Mhm.
we know that this rhythm has what problem?
Atrial.
Atrial.
Okay.
So we know we have an atrial problem because there's abnormalities with a P. Now continue with your checklist first.
Okay. So we're looking if there's one P per one QRS, which
Mhm.
there's not. We see about 3 Ps
Uh-huh.
per one QRS.
Huh. Okay.
And then we're looking at the PR interval if it's normal or prolonged.
Mhm.
So
You can't measure that
right,
because there's too many P's.
right,
So that's gone,
okay.
which tells you, okay, this is not a AV block issue, right?
Right.
This is an atrial issue. God bless you. It's an atrial issue.
Yes.
Okay.
And then I'm looking at the QRS if it's narrow or not,
Okay.
which it's normal
Okay.
because
Good.
it's worth one small box.
So this is not a
ventricular issue.
correct.
And then we could look at the ST segment at baseline.
Mm-hmm. Can't do that either
Yeah, like where do
because
I look?
we don't see the T's.
Right.
The T's are behind the many P's.
Okay. And then, so we can't look at the ST, and I can't tell you if the T wave is tall,
Correct.
normal, or inverted.
Correct.
So.
So we have an atrial problem. And you said that the P's are not normal looking. So is it coming from the SA node? So
I
look
would
back.
say.
Do you have the picture of the
Yeah.
thing that's on the board?
Yeah.
Did you guys take a picture of the board?
Yes.
So remember we talked about sometimes the SA node is firing as well as the other foci too, right?
Okay, so there's an irritable foci, meaning there's an impulse coming from outside of the conduction system,
Right.
and we know where the impulse is at based on the rhythm that we're seeing, and we're seeing abnormal P's, so therefore that irritable foci is in the atrium,
So
right?
it's
So then therefore we can't call this sinus. It's not coming from the SA node, it's coming from the atrium somewhere. Okay.
So we know it's an atrial dysrhythmia. I wouldn't say ATAC because our rate was within normal.
Good.
And then if it's AFib, it's a disorganized P wave. They're narrow and good looking. And the R
QRS.
to R.
So in fibrillation, you can't tell where the P waves are at. They're kind of more worm-like.
Okay.
They're undistinguishable.
Okay.
So are these undistinguishable or distinguishable? Can you tell where they're at?
I would say yes.
Yeah.
Yes.
Okay. So then therefore it's not
AFib.
AFib. Also in AFib, what happens with a rhythm?
R to R would be irregular.
Right. And this is pretty regular.
They're regular.
Right?
Yeah.
So you rule that other thing out. Okay. So what's left?
A flutter.
Very good. How much? What conduction? What conduction? How many P's to QRS?
3 P's to 1 QRS.
So this is an A flutter with 3 to 1 conduction.
Oh, okay. I see.
The atrium is fluttering 3 times, and then the SA node is able to come in and create a full conduction system cycle, which is why you have the QRS. A PPP QRS, PPP QRS.
Okay.
Yeah.
Nice.
Very good. All right, X that out for me.
Yep.
All right, Annie. Isn't that fun?
It's getting better.
Let us. Can you pull the 12 lead for me, please? I just want to see something first. Let's see if this is what I want to show. No, I don't want to use that one. It's not very definitive. Can you refresh that for me, please? Do it again, the 12 lead. No, I don't want that one either. Sorry, I'm just looking for a nice one that you guys can actually see. Hit play on the top left. Pause. Get one last attempt. Play. Okay, there we go. I like that one. Once it fills in, you can pause. Actually, exit out for a minute so you can look at the telly first. Okay. So, just by eyeballing it, let's go through the motions. Let's go through the steps. So
Just by
rhythm and rate.
Rhythm seems regular.
Okay. Rate. Now count. Have you practiced counting the rate? Yeah, let's go back to the 12 leads and count the rate, by looking at lead 2, please. And then when it's done, make sure it stops playing. Okay. Oh, pause. It's gonna stop when it hits the end.
Almost like a supraventricular.
Okay, so rhythm is regular.
Rhythm seems regular or out.
Yeah, go through the motions.
Remind me again, rhythm is from
R to R.
R to R.
The very top of the R's.
Pull the page inside out.
Just hold it in a different area. You have so many lines in there already, my good patient.
It's regular.
Okay, regular rhythm and the rate. So how do we count the rate again?
The box
Tell me your
between the
method again.
The count the big
between the-
boxes between R to R.
So you're still looking at the tip of the R's,
tip of arm.
and then you're looking to see how many boxes are in between the two R's.
5, 10, 15, 20, 23.
23. Okay. So what number is a constant that you use?
1500
Very
divided
good.
by
Okay.
23.
Okay, good.
Here, I got your here.
That's 65.
Mhm.
Thank you.
Okay, so what can you say about the rate?
It's regular.
Oh, normal.
Normal.
We use regular for rhythm. Okay, so normal rate. It's within your
Normal rate.
60 to 100, kind of on the borderline, almost low,
Okay,
right? But
almost
still
okay.
normal technically, right?
Okay.
Okay. So no problem with the rate, no problem with the rhythm. Continue.
Now I'm looking at the P waves.
Okay.
Whether they're present.
Yes.
And I do see P waves. They
Okay.
appear normal with
And they're normal looking.
yes.
Okay, very good.
And I see a P wave for every
QRS.
QRS.
Excellent. Okay, good. So no irregularity.
Mhm.
Okay,
So
Next.
we can say that the atrial is not an atrial problem if there's one.
sure. Mm-hmm.
And next I'm looking at sorry, I'm not what's your sorry I don't have your system down.
That's
yet.
okay. That's okay.
So help.
You do you.
If the PR interval is normal or prolonged.
The PR interval is normal. It's not prolonged.
Okay. So it's normal, but are they all consistently normal?
Okay.
From the beginning of the P.
Just to be sure.
Mm-hmm.
So the PR is from beginning of the P to the R
Q
to the Q side.
or the QRS complex, you could say.
Seems so to me.
See what?
It says seems so to me.
What? Normal?
Mhm.
Normal and constant.
Normal and
Okay. So
constant.
no. What problem? No what?
No blockage in the
That's
atrium.
right. So no AV blocks.
No AV blocks.
Right? So we're not looking at any AV blocks. Okay, next.
Next, I'm looking at the
The QRS.
QRS.
If it's
Oh, yeah.
narrow.
QRS is narrow,
Okay, good. So
Right.
no.
so we don't have any ventricular.
Very good. Okay, so no ventricular rhythm.
Rhythm.
Right? We're not going to call it ventricular. Okay, next.
Next, I'm looking at the T wave.
Mm-mm. Not yet.
ST segment.
ST segment.
There we go. That was the fun part. That's the
Okay,
fun
so
part.
ST segment, what are the options? And remember, we're only looking at lead 2 right now, yeah? So is it at baseline? Is the ST segment at baseline? Is it
No.
elevated or is it depressed?
It's elevated.
It's elevated. How elevated is it?
Oh,
So 1 small square is how much? No.
0.04.
A height.
Oh,
Height
height.
twice.
1 small square, 1 millimeter.
Very good. 1 millimeter. So this is elevated by how many millimeters? So only the
10?
ST. Only the ST. Where's the ST?
Right here.
Yeah. Okay, don't look at the T, right? So just the ST.
By 5.
5 millimeters. So which means it's significant.
Mm.
What's a significant elevation is a greater than 2. Okay.
Okay.
Or depression greater than 2.
Okay.
So far we have a, what do you see? ST. Amy?
Hmm?
What is this? ST. Is it elevated,
Elevated.
depressed, or normal?
Elevated.
Elevated. So we
So
have
an
an
ST
ST elevation. Okay.
Mhm.
Let's just go through the motions. And what about the T?
The T seems elevated as well.
Mm-hmm. Okay. And we know that, and it's greater than, what is our comparison again? How tall should it be? The height of the
Did you say
the
1?
R, right? It should only be 1/4 to 1/3 of the height of the R, but because the ST is elevated, then naturally the T becomes elevated as well, right? Or not naturally, but in this case it's also elevated, right? Because it could be a tombstone where it's not as tall, the T wave, but it's just going to be the same height.
It could be like kind of flat.
Yeah, kind of flat, yeah, but it's not flat, it's also tall, which again validates the, what's the problem here, Ami? If the ST is elevated, what's the problem? What are we looking at? Look at your notes. Where are your notes? Yeah, ST elevation, ST depression, what do those mean? Oh, probably not those. Do you guys have notes on those?
Well, we
No.
talked about when elevated or depressed, we're looking at underlying causes of the MI or ischemia.
Correct. So which one is which?
So elevated would be MI.
Huh. That's right. So this is a STEMI, right? So if we're so that's a different thing, right? If we're looking at the rhythm itself, if the STEMI wasn't there, what kind of rhythm would this be, Ami? It's normal rate, it's regular rhythm, there's a P for every QRS, the QRS is narrow. If there weren't an ST elevation, what kind of rhythm would you call it?
Would it have been like a sinus?
Very good. It would have been an NSR, right? So you would say NSR with STEMI. Okay. So now let's take it further. Now we're going to look at the precordial leads because we want to know where is the STEMI. Okay. If you guys took a picture of the board, I put on there in the picture of the heart the precordial leads. Okay. So if you look at that, you'll see V1, V2, V3, V4, V5, V6. Okay, those are the precordial leads. You're right on they're looking at the heart from different angles, right? So Jessica, V1 and V2, they look at what?
We're looking at the right atrium or the right ventricle.
The right ventricle. And then what about V3?
V3 is looking at the right bundle branch.
No, right ventricle still, but from the inferior,
Oh.
right? So V3 and V4 are looking from down below, but V1, V2, V3 are looking at the right side of the heart, which is right ventricle. V4, V5, V6 are looking at the left side of the heart, but V3, V4 is right there by septal, by the septum,
That's
right?
what we said, yeah.
Inferior, okay? So now look at the precordial leads here, which is V1 through V6, and tell me where you see the same problem that you see in lead 2.
V3.
V3, do you see it on me?
No.
Look at 3. Look at the 3 strip. There you go.
Uh-huh. Now I didn't go over AVL, AVF, and AVR. So those are extra leads. AVF is inferior also, and then AVL is on the left. Okay. AVR we actually don't look at. The only reason that we look at AVR is to make sure that the EKG leads were placed correctly. Okay. So, but in this case, so where do you see the problem again? Which V lead? Which precordial lead? V3. So which side of the heart is the problem at?
Right
Right
side.
side.
The right ventricle. So the patient is having an MI in the right ventricle, maybe more inferior, right? Because it's in V3. We don't see it in V2. We don't see it in V1. Does that make sense?
At the base of the septum, right?
Mm-hmm. But in the right side.
Right side.
Yeah. Make sense?
Yes.
That's advanced. But it's kind of good to know,
Yes.
right? When you're looking at 12-lead EKG and you see this is STEMI, okay, let me just take a peek and see if I can figure out where the STEMI is at.
Camera angles.
Yeah, exactly. Get it? Good job. X that out for me, please.
Oops.
XX. Yep. All right. Who's next? Is that hard? Is that hard on me?
I think it's just a little bit harder for the
Yeah.
basics.
Yeah. True.
Yeah.
From the resources that we look at, a lot of the same, like when it comes to the steps of assessment,
Yeah.
a lot of it is the same, but you have, like, for example, the way you're counting is different from,
How are they counting?
I think, because you said that, for example, with the rate, I think you said you did something different, or was it with the,
That's what we've been dividing.
was it, no, it's the standard number, the 1500? Is that something that's different for us?
Now on the Joshua, that's the one you say you don't really like.
Oh, you
6
count
to
the R?
1.
Yeah.
R? No, don't do that. That's so
There you go.
basic. No.
Thanks.
You're more intelligent than me.
So basic.
Well, this one is very accurate. Your method is very accurate.
Yeah.
Don't
Well,
be
it's not
slow.
my method.
Don't
It's the standards of medicine.
Okay.
All right.
All right.
Let's go.
We're looking like tombstones here. Okay.
So go through the motion.
All right. Looking at the telly so far, I see an OP waves.
Okay.
See no P waves. I see a
Wait. Back up.
Okay, backing up. Rate,
Rhythm.
rhythm,
And rate.
rhythm, and rate. So let's go here. Okay. And I can pause, correct?
It'll pause automatically once
Okay.
it's done. Okay. Maybe play it a little bit so that you don't see that. There we go. Because that was inaccurate on the left side. And then pause it when it gets to the end. Good. Okay.
Okay.
So we're looking at lead 2.
Lead 2. Okay, we're looking at rhythm and rate.
Mm-hmm.
Okay.
So you still have R waves there.
Yes, we
right?
have R waves.
So still looking at the tip of the R waves.
Is it standard practice to go all the way towards the end of the strip, or
Well,
Work
you
like that.
know, if you want to be thorough,
okay.
because I could eyeball it and say, oh yeah, that's regular, right? But
Yeah.
for a beginner, it's best practice to just be thorough and do it all.
Okay. So it is it is consistent.
So then the rhythm is
Regular.
The rhythm is regular.
Rhythm is regular.
Okay, and what about the rate?
The rates. Let's see. So I have 8 small boxes.
It's 8.
8. Mm-hmm.
Okay, so
So
and let me tell you why I don't like for a 12 lead, you can't do the counting of the R's. This is not a 6-second strip, right? That only works for the 6-second strip, and then you add a 0 at the end. And then your numbers are always going to be 50, 60, 70, 80, 90.
that is
Very
correct.
inaccurate, right?
So I have 8 small boxes, so that's
Okay.
8 multiplied by 5. No,
We
I can't.
multiply. We divide, what is this, the
1500.
number?
Yeah, I added a step
What's the
in there.
constant?
1500 is the constant.
Divided by,
8.
uh-huh,
So that gives me 187.
uh-huh.
So that's far out. That's far beyond.
So
That's
we know that this is by category, what kind of rhythm? A
tachycardia.
tachy. We got a last name.
Okay.
Now we gotta find a first name. Okay, go through the motions.
Okay.
What's the next thing we'll look at?
We're looking at the presence of a P wave.
Okay, is there?
No.
No. Okay. Next. So therefore there's no PR either, right?
So,
There's
yes.
no P.
No P, no
And
PR.
we know there's no 1 P for every QRS because there's no P, so we're skipping all that.
All right.
Okay, next.
We're looking at the QRS complex.
Okay,
And we have a widened QRS complex
how
here.
wide?
Let's count. And I'm counting
base.
from the base, correct?
Mhm.
Okay. Eight.
Eight small squares.
Yes.
Okay, so we needed how much to be narrow?
Less than
Less-
Less
0.12.
than how many small
5.
squares?
Is it?
What do
No,
you
no, no.
have?
How many small squares? We want it less than
3.
3.
3 small squares.
So it's way more than 3. Right? Way more than 3.
Okay.
So we got wide QRSs, so therefore this is a what problem?
Ventricular problem.
Okay. And what was the first name? What was the last name?
We have a tachycardia.
Okay, so what is this rhythm?
Repeat that.
Ventricular tachycardia.
Good. So now, if this was a real patient, what would you check first? Because your intervention would vary.
Okay.
Would depend on what you check next. So what do you check? Pulse. Right?
Mm-hmm.
If there is a pulse, Jessica, what will we do?
If there is a pulse, then we cardiovert.
And what medication might be one of the first choices per American Heart?
Adenosine.
Adenosine. Okay. If there is no pulse, what do we do?
Okay.
Yeah, defibrillate. Very good.
Okay.
That's it.
Okay.
Good job. Okay, exit out. Next one.
Let's play.
Let's see this one here. Going to kick it up a notch for Jessica. Let's see. Make it nice. Hold on. That's not the right rate. Okay, that's better.
Okay, so first
Yeah.
we're looking at the rhythm. Off first glance, it already looks irregular.
so this is what kind of irregular?
Kind.
Regularly irregular or irregularly irregular?
Regularly irregular.
Very good. What made you say that?
Because it's consistent right here,
Uh-huh.
and then actually it's the same interval, like from right
If
here
there
to
was
right
one there.
Yeah.
Okay, excellent.
And then I'm looking at the rate, which is R to R.
Mm-hmm.
So 5, 10, 15, 20, 1, 2, 3. So for the rate, I got 65.
Okay.
So that's normal.
So it's a normal rate, normal ventricular rate.
Mhm.
Okay.
And then we do have P waves present.
Uh-huh. So first, do they look normal?
Smooth, equal on both sides.
Mm-hmm.
So I would say yes, they look
Okay,
normal.
normal looking P waves.
Uh-huh.
Next.
And then there's one here for QRS, one here for QRS, one here for QRS, and then this right here, but there's no QRS.
Okay, so we have a non-conductive P wave. Okay,
Non-conductive
so
P
far
wave.
we know that there's a non-conductive P wave.
Uh-huh.
Okay, next.
And then we're looking at if the PR interval is normal or
Okay.
prolonged.
Mhm.
Wait, that line.
Maybe fold it so you don't have a lot of lines. So you don't get confused.
Okay, I found the lines for this one. I'll
Okay.
fold it on the next one if I need to. Okay, so they're consistent.
They're all consistent, all the
Uh-huh.
same.
They're consistent. As far as the prolonged or not, we're looking at one big square. So they are a little bit prolonged.
Mm-hmm.
So this tells us that it could be potentially AV block.
Uh-huh, good.
And then I'm gonna look at our QRS, which is narrow, so we could knock out ventricular
Good.
issues.
Okay, good.
And then I'm looking at my ST segment, which is
good.
at baseline
Okay, good.
consistently.
So no MI, no ischemia.
Mhm.
Mm-hmm.
And then our T wave meets the criteria. It's no more than a third compared to our R wave. So going back to my AV block, we said that the PR is prolonged and it's consistent. Let's see here. Prolongs progressively, QRS drop. So,
Can you measure these three for me, please, again?
Mhm.
These three PR intervals. So from the beginning of the P to the end, to the beginning of the QRS complex.
right here.
Okay, now march it out again for me. Okay, next one. They're all the same?
Yeah, those are all
Okay,
consistent.
Okay,
And then that one is consistent as well.
okay.
So,
So they're
I would say,
there's consistent PR intervals, but
Right.
they're prolonged.
right. So we're kind of looking at first degree
But there's a
QRS drop.
QRS.
Uh-huh.
Mm-hmm.
But then it doesn't really meet the. Okay, so
So
then
back
PR
up.
interval.
If there's associate keywords with the AV blocks, right? If
Uh-huh.
you hear a drop QRS, if you see a
Right.
drop QRS, that
Immediately.
limits your options to 2.
Right, second degree.
Okay, second degree.
Mm-hmm.
Now which one? First,
So-
type 1 or type 2?
I'm looking at Mobitz 2
Why?
because our PRs, it says either consistently prolonged or normal.
Uh-huh.
Ours are consistently prolonged.
Good.
And there's a QRS drop or a
Good.
non-conductive P wave.
Yeah.
So I'll say it's an AV block second degree Mobitz 2.
Excellent.
Okay,
Very good.
thank you.
Next. All right. Okay. Exit out. Come back. Computer is tired. Exit out. Exit out. We're gonna reboot it. Yeah. Okay, and then click on the little baby icon at the bottom here.